So today we're going to remove the grafts from basically the beard area underneath the chin. So do you mind lifting up? We're going to remove the grafts from right here. So what is this used for? Why do we do it, right? So this is for people that have limited donor hair in the back of the scalp, or mainly for patients that have a scar in the back and they want to fill it in. In this case, right, he has run out of grafts from the back of the scalp, which is the donor area, and we still want to add more, so we are using body hair to add it as fillers and add more hair. We also have done the chest as well. This area on the top, right, we removed about almost 800 grafts about a month ago, and it's healing. And this area we did about a week ago, exactly 1 week from now, a week ago, and it's healing as well. And you can still see some of the grafts are regrowing. So we got about 800 grafts per session. Now, not all those grafts are grafts with 2 hairs, but you know what? Hair is hair, and if you want to use it for a limited area, for example to cover a scar from a strip hair transplant, or to add it as a filler, it actually works pretty well. Criteria: you need to have a good body hair, and 2, you got to be patient, because body hair takes time to regrow. Okay, so for our gentleman here, he had a procedure many years ago where they filled the front and then he ran out of grafts in the donor hair from the back of the scalp. So using body hair, we basically started from here and we worked our way up to here. Today we're just going to continue making the crown and the calic and going in a downward direction. The important thing is that in this case, since he has a limited donor hair, we don't want to be too tight, too dense. We just want to create very similar density to create a balance and harmony between what he currently has and what he, the area that are completely bald. So today we're going to do the beard area. We're going to put the grafts here, and he probably needs one more session after that to cover the fringes on the bottom, and that should be pretty good. I'm going to follow him throughout the next 1 year, see how he does. So this is the area that I have allocated for the beard. Now you're going to see that I've drawn these zigzag patterns, because even with extraction, nothing is on straight lines. Nothing's on straight lines. I have this philosophy that you rub and scrub 20 times to make sure it's fully clean. Do you feel any pain?
Not at all. Are you doing something?
Yep.
Oh, okay.
So right now we finished extracting about 900 grafts to 1,000 grafts. We haven't counted fully. As you can look, it looks actually pretty good. This is right immediately after. There was not significant oozing or bleeding. And we're going to follow up with him tomorrow, the next day, to see how this heals as well. So, how are you feeling?
I feel great.
Excellent, wonderful. So now the next step is actually making the sites. Now, so far we have worked this much, getting the grafts from the chest. So now we got almost 800 grafts from the beard area, and we're going to be putting it in this area. So he's already numb, so he shouldn't be feeling this. I'm going to be testing something. Now I'm going to make the calic, and then we go from there. So, do you feel this? Pain? Perfect. Another 18. It's good to be left-handed as well as right-handed, because it definitely comes in play. That makes a huge difference. But again, he's all numb, so he shouldn't be feeling any of these. Okay, so now we're gonna start placing few things. So first, this is a cup. This is actually made out of pure silver. I make it, and it holds the temperature of the tissue at 2 degrees Celsius, 2 to 4, which gives you basically the best grafts of viability. And all the grafts are also embedded in certain growth factors. So I take a graft hair follicle, and I put it in, and I kind of align it so it's going in the direction that I want. Then I take another one right at the bulb, right? So at the bottom, so we're not really touching it that much. And again, I followed that direction, right? And you could see how smoothly, right, this goes in. Okay, so we are back with our patient. We did a beard hair transplant. So we removed the hair from the beard area, and it was about 4 days ago. So tell me, how's your recovery?
Honestly, I recommend it for if you're gonna take any body hair from anywhere, take it from here.
The beard is good.
It's the easiest. You have no pain and the easiest recovery.
Let's take a look at look up for me, see how it looks, and so it's just after a few days. After a few days, it's really healing, amazing. So, do you take anything for pain at this time?
I didn't take anything.
And the recovery easier?
Very
Perfect.
easy.
And we got over 800 grafts. So that's great, and it's ideal for, taking the hairs, putting it in scars, it works actually pretty well. Excellent.